Hello, my name is Kathy, and today I'll be discussing how to use homeopathic remedies on ailments, continuing with Fertility and Pregnancy R and S. But before I do this, I wanted to let you know that because I have a great many videos now on many different topics, that I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Please refer to my How to Use Homeopathic Remedies video before using the material in this video. I will be discussing how to use homeopathic remedies on specific ailments, but I've broken these ailments into categories for easier reference. I'll begin with ailments of the mind and emotions, then I'll move on to ailments of the brain and nervous system, then I'll address issues with your skin, nails, hair, eyes, ears, nose, teeth, gums, lungs, respiration, heart, blood, circulation, muscles, bones, joints, esophagus, stomach, duodenum, small and large intestine, liver, gallbladder, and pancreas, kidney, bladder, and then ailments specific to women and specific to men, then issues of the hormones and metabolism, then remedies for infections, infestations, and the immune system, issues surrounding fertility, pregnancy, childbirth, postnatal problems, homeopathic remedies for infants, ailments and diseases in childhood, and special issues of adolescence, and finally, special issues of the elderly. Constitutional treatment involves treating the totality of the individual person. Everyone is a unique individual with a unique physiology that responds to substances differently. In homeopathy, it's recognized that people will react strongly to certain remedies, and as a result of this, they can be loosely placed into different categories called constitutional types. Homeopaths talk of, for example, phosphoric types. These are people who react strongly to phosphorus, or Arsenicum album types, those who react strongly to Arsenicum album. The belief is that people of one type share similarities in terms of body shape, character, and personality, and the sorts of diseases from which they suffer. As an example, nature mirror people tend to be pear-shaped, have a dark complexion, be fastidious and rigid in personality, and keep themselves to themselves. They also crave salt and suffer from constipation. As another example, lycopodium types tend to be tall, gangly, and of a stooped appearance, with an anxious expression and a craving for sweets and a propensity to produce intestinal gas. Now, of course, constitutional types have their limitations. In reality, each person is an individual, and so there are as many constitutional types as there are human beings. An account must be taken of the sum total of the person's inherent predispositions, past illnesses, diet, general reactions to the environment, intellectual and emotional features, and general attitude towards life. This is what is meant by constitutional treatment. I'll be making detailed videos of the various constitutional types after I've completed the use of homeopathic remedies on ailments. The ideas, procedures, and suggestions in this video and all my homeopathic videos are not intended as a substitute for the medical advice of a trained health professional. Consult your physician before adopting the suggestions in this video. If you're pregnant, do not attempt these techniques without the approval of your physician. So, let us continue with learning how homeopathic treatments can help with fertility and pregnancy, R and S. Every month during a woman's reproductive years, a ripe egg is released from her ovary and enters the fallopian tube, and the mucus at the entrance to the womb at this time becomes less sticky. If intercourse takes place, millions of vigorously swimming sperm make their way through the mucus into the womb and into the fallopian tubes where they congregate around the egg, causing it to spin around with the movement of their beating tails. Eventually, one sperm penetrates the egg and nucleus of sperm and egg fuse, and the process of cell division begins. The fused nuclei split into 2 cells, then 4, then 8, then 16, all containing the 46 chromosomes that will create a new and totally unique human being. 7 days after fertilization, this ball of cells embeds itself in the wall of the uterus. At 20 days, the placenta begins to form. At 30 days, the spinal cord. At 6 weeks, the heart. And by 13 weeks, all the body organs are formed. At 5 months, the baby can be felt to move. At 6 months, the lungs become functional and the nostrils open. At 7 months, the baby should be in the head-down position ready for birth. A full-term pregnancy usually lasts 38 weeks, counting from the moment of conception to the full time the baby is born. Conception usually takes place halfway between periods if the woman's cycle is 28 days and regular. However, since many women's periods are not exactly 28 days, pregnancy is usually measured as being 40 weeks from the first day of the last period. Common pointers to pregnancy are missing a period, more than usual tender or swollen breasts, and darker nipples, nausea, tiredness, a frequent urge to pass urine, and sometimes loss of appetite or cravings for unusual foods. To confirm the pregnancy, the woman should have a pregnancy test. The chances of having twins are about 1 in 80. Identical twins develop from the same egg and share the same placenta. Non-identical twins develop from different eggs and have a placenta each. Only 3 pairs of twins in every 10 are identical. Triplets are much rarer, only occurring in 1 in every 6,400 pregnancy. Once it is determined that the woman is pregnant, it is important for her to go for regular prenatal checkups. Prenatal care is important since it allows you to find out at an early stage if there are any problems. An ultrasound, which is a sound picture of the baby in the womb, is thought to be harmless to mother and baby and can be used to monitor the size, shape, and position of the baby at any stage of pregnancy. Amniocentesis, which is the taking of a sample of the amniotic fluid around the baby, is usually carried out between 16 and 18 weeks, but only if a previous baby has been abnormal or if there has been a family history of congenital problems, or if the mother is over 35. Here in brief are some of the do's and don'ts of pregnancy. Treat your baby as a person from the word go. Moderate exercise such as swimming or walking in the fresh air are very good, and anything that involves repeated compression of the spine such as horse riding or trampolining should be avoided. Always keep 25% of your energy in reserve. Do go to the prenatal classes. They will teach you what to expect and how to breathe in order to cope with pain during labor. Don't wear tight clothes and get as much sleep as you can and avoid late nights. Also, don't sit in hot baths for too long. 10 minutes is about the maximum, especially if you faint easily or have a tendency to bleed. Avoid serious travel if you can, especially if you have had a threatened miscarriage or there are complications or you suffer from travel sickness. Most airlines do not like you to fly after 32 weeks or so. So if you must fly, check with the airline first and stop working within 28 weeks if your work is very strenuous. The expectant mother needs to eat a healthy, well-balanced diet with an increase in iron and calcium foods and also a modest increase in protein intake, preferably in the form of oily fish, nuts, seeds, pulses, and whole grains, with generous helpings of raw vegetables and fruit, will help to guard against constipation. Tea, coffee, and alcohol should be avoided, as well as chamomile tea, especially in the latter stages of pregnancy. Homeopathic remedies during pregnancy. During the first 3 months of pregnancy, the most vulnerable time, you should avoid all medication if you possibly can. That means prescription drugs, recreational drugs, over-the-counter preparations from drugstores, and health food shops. There is no evidence that homeopathic remedies cause any problem during pregnancy, but to be on the safe side, they should not be taken in potencies less than 6C, except for tissue salts. It's probably best to avoid low-potency apis altogether and take 30C if you need to. For minor complaints during pregnancy, homeopathic remedies should be tried first. If you feel very unwell, see your doctor before taking anything else. Respiratory changes during pregnancy. Respiratory symptoms such as shortness of breath and coughing are not uncommon in the last months of pregnancy, especially if the baby is large and the mother small. The diaphragm and the rib movements that pull and push air in and out of the lungs are, to some extent, hampered by the upward pressure of the uterus. The lungs also become congested because of pressure on the veins and arteries, making gaseous exchange less efficient. Digestion is often affected, too, for similar reasons. If the coughing is severe, see a doctor in 2 hours. In the meantime, take Aconite 30C every 5 minutes for up to 10 doses, especially if fear is the overwhelming emotion. If you are short of breath, even when at rest, see a doctor within 12 hours. Specific remedies for coughing, to be taken 4 times daily for up to 7 days. Coughing after meals, shortness of breath, use Nux 6C. Frequent dry, exhausting cough that gets worse at night, salty taste in mouth, use Sepia 6C. Cough accompanied by nausea and vomiting, use Ipecac 6C. Cough accompanied by involuntary passing of urine, alleviated by drinking cold water, use Causticum 6C. Specific remedies for shortness of breath, to be taken every 5 minutes for up to 10 doses as soon as symptoms come on. With palpitations, fainting, fear, use Aconite 30C. With weakness, swollen ankles, pale face, and an anguished look, feeling chilly and restless, use Arsenicum 6C. With nausea, fainting, use Ipecac 6C. Skin changes during pregnancy. Skin changes during pregnancy are caused by raised hormone levels. Specific remedies, to be taken 4 times daily for up to 7 days. Brown, dirty yellow freckling over the bridge of the nose, use Sepia 6C. Skin, dry, itchy, hot, and scruffy, made worse by washing, use Sulphur 6C. Sleep problems during pregnancy. Anxiety about pregnancy and birth, heartburn and urge to urinate, general discomfort, the baby kicking, all of these can break sleep during pregnancy. Then worrying about not sleeping makes sleeping even more difficult, and so a vicious cycle is set up. Specific remedies to be taken before going to bed for up to 5 nights and hours if still awake. Overexcitement, mental overstimulation, excessive joy, use Coffea 30C. Feeling you will never get to sleep again, especially after some form of grief, use Ignatia 30C. Feeling very afraid, use Aconite 30C. Self-help. If you cannot get comfortable in bed, tuck a pillow under your abdomen, into the small of your back, between your knees, or wherever you feel you need support. If you still cannot sleep, don't be tempted to take sleeping pills, especially in the first 16 weeks of pregnancy. Get up and read a book or do housework or make up for lost sleep later. Enlisting your partner's help if necessary. I have a great many videos now on many different topics, and so I decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Well, that's it for now. To stay up to date with my latest videos, make sure to subscribe to this free YouTube channel by clicking the red subscribe button right below this video. Take care.